Welcome to this briefing of the Jerusalem Press Club, JPC, another one in a series of webinars titled COVID-19 Round 2 we've been running for the international press. I'm Uri Dromi, Director General of JPC, and today we host Professor Balicer, MD, Founding Director of the Research Institute and Director of Innovation, Director of the Health Policy Planning at Clalit, Israel's largest healthcare organization, and he is also a member of the Health Ministry COVID-19 team. Professor Balicer, thanks for taking the time to be with us today. With so much confusion surrounding the present COVID-19 pandemic, we need a guide to the perplexed. So can you give us a brief introduction to where we stand today vis-a-vis this unprecedented phenomenon? Do we know more now than we knew in late February? Are we taking the right steps to combat it?
First of all, Uri, thank you kindly for the opportunity to speak with you today, and thank you all for being here. The question that you ask is a tough one. I must admit that when I compare where we are today in terms of what we know about the illness and its dissemination, and what I thought during late February to where we should be 6 months into the event, I am surprised, and not for the better. There are so many question marks and open-ended questions at this point, many more than I have anticipated that would be at this point in time. Even the most basic questions: what is the case fatality rate? What is the mechanism of dissemination? Are we talking about a droplet or an airborne infection? Which risk groups are most likely to sustain a severe disease? And I can go on and on. What is the long-term impact of this illness, or medium-term impact of this illness on those who have are convalescent and did not have a severe disease? Are there any sequelae for the medium and long term? Now, all of these seem very basic, but they are all still under, there's a question mark above each and every one of these. Some things have now become a little bit more clear than they have before. It is quite evident that the disease has a potential to cause severe illness, a multifaceted illness of many different systems, and it is not just a disease of the lungs, okay? It is a disease that causes a morbidity that is pretty complex. Most of the population will have a fairly mild disease at early, but the percentage of those that will develop a serious illness with a severe exacerbation can be exceedingly high, especially among the older risk groups and those with specific coexisting chronic diseases. So this has become clear, and we have been able to elucidate a little better which specific subgroups are at risk, and I will touch upon this a little more in depth later on. So that has become clear. This is not the flu. The case fatality rate, the infected fatality rates are higher than those of the flu. But above and beyond that, we do understand now that unlike flu, which is a limited infection of several months in a year, that are also limited by the availability of a vaccine and immunity, residual previous year immunity among much of the population, this is not the case here. And so the high number of susceptibles, the potential for a severe disease, and some of the pictures we've seen from countries inflicted make us understand that we need to take this disease exceedingly seriously. In terms of disease dissemination, again, many question marks still exist. By now, we would have thought what is really needed in order to sustain and prevent an uncontrolled dissemination. Countries have taken different policies and have seen different outcomes, but it is very difficult to make a causal clear inference between the illness and the outcomes, and if whether there's no one magic wand that any single country can use in order to get there. And soon I will talk a little bit about where Israel is and what has made us come to this point.
But still, some things seem to clear up. For example, do you share the view expressed by Professor Matteo Bassetti from Genoa, one of the top front lines of the pandemic, who said it was like an aggressive tiger in March and April, but now it's like a wild cat. So, which means patients, even elderly patients, are now not so affected by the disease. Do you share this view?
So I will divide my answer in two. First, I have not seen any molecular evidence to the fact that that is true, nor when we look at the second wave of illness we witness now in Israel, we still do not see a marked difference in the specific rate of admissions, hospitalizations, and severe illness in the second wave that we're experiencing as compared to the first one. If that had been true, we would have seen many, many fewer cases of severe illness, which we do not see. And in several other countries also, the picture might be similar. So on one hand, we do not know that the virus has mutated and changed for the better in terms of its potential. On the other hand, some other things have changed and have changed dramatically. First of all, the elderly and the susceptible populations protect themselves better now as compared to early on. So when you look at the general rate of infection in any given population, the percentage of the elderly that are being infected as part of the overall infection rate is diminished dramatically. In Israel, it has diminished twofold. So obviously, the rate of severe outcomes in a crude population view would be decreased by twofold just by that fact, by the fact that the elderly protect themselves better and by the fact that the country has taken bigger responsibility on protecting them. So this is one example of why we see a less severe disease. The second point to take into account that our technical capabilities and the armament that we have in order to treat severely ill patients have increased significantly during this time period. We've learned better about what works and what does not work in preventing death and severe illness. We now know that, for instance, the use of steroids is appropriate in some of the severely ill cases that reduces mortality in a serious way. We have increasing amount of information about specific drugs that may be useful in preventing further deterioration. So, and we know when and when not to intubate and provide artificial respiratory support. So that is something that therefore has dramatically increased our ability to prevent deaths. And in Israel, I think we have taken many of these approaches fairly early on, which explains why in Israel the mortality rates of and the fatality rates of those infected has been one of the lowest ones in the world. We had very few deaths as compared to the number of people that we've identified as being infected. So the answer to your question is, yes, we are better off today. We're better off not because the virus has reduced its potential, but because we have improved the protection rates of the vulnerable population, and because more young people and healthy people are being infected as compared to the older ones, and also because severely ill patients die less because we treat them better.
One of the main issues in fighting this pandemic is trying to strike a balance between public health and a viable economy. You yourself said once that we have to find a new normal in balancing a less restricted economy and preventing a surge in infection. How can innovation and technology assist in achieving this goal?
I think first we have to iterate again and again. This is not an equilibrium or two opposing vectors of the economy on one hand and public health on the other. There's nothing worse for the economy than a raging infection that is out of control and is filling up the hospitals and is making people stay worried home with or without a lockdown. So the need to maintain a sustained dissemination of the disease is an economic interest as much as it is a public health interest. And so this is why we need this new normal, this minimal level of population restrictions that allow the disease to stay under control and on the other hand, maintain the economy in its largest extent to work business as usual as much as possible. So the most basic things are really simple and are reiterated again and again everywhere. It's distance. Most important thing is distancing. Distancing is the key to everything. When distancing cannot be maintained in an appropriate way, which is in many different settings, then masks are, which are generally important, become even more crucial. So the combination of masks and social distancing are the key to maintain a normal living scenario as much as possible, a viable economy, and this is one component. But if we go to the other aspects, these are the ones in which the government can help and the health authorities can help in reducing dissemination through reducing infection from person to person through epidemiological investigation, contact tracing, and isolation to those people that have been identified, and massive testing. Now, technology here is key. When we talk about testing capacity, there are various innovative ways in which we can allow a limited laboratory capacity expand. There are different methodologies now being looked at. There's different types of testing that is innovative. There's pooling of testing in order to allow in a certain amount of reagents and swabs to achieve a better outcome in terms of the number of people that you test. And there is, of course, a lot of technology now, a surge of technologies that improve contact tracing and the ability to allow effective isolation to those that have been identified to be exposed to an infected patients. Now, the combination of population behaviors on one hand and those new technologies coming in are really helpful. Above all of this is the improvement of surge capacity, which means how can we help the health system sustain a larger number of patients at a single point in time without being overrun, basically, or overloaded by the severe cases. These include better ways of providing respiratory support to a higher number of patients. It includes new types of protective equipment, PPEs, personal protective equipment, to the teams in the front lines and preventing their infection while allowing them to provide work as usual. The various aspects of telemedicine and telecare. It could be telemedicine of how to keep the patients at home and yet provide them with appropriate service, but also within the hospital setting, how to be able to provide care to patients within the COVID-19 units without actually physically going in and exposing more people to the virus. So these are all different domains where technology is now being critically appraised and some already being massively put into practice. And this would allow us much better control and much better sustainment of disease when it goes out of control.
You spoke about distancing. So do you think that opening up the economy was too quick because it went opposite, quite the opposite against the distancing, because people were clinging to each other again, maybe too soon?
You know, there's a very dangerous tool that is called the retrospectroscope. It allows you to look at perfect 20/20 hindsight and be exceedingly smart about what you should and shouldn't have done. If I use this very risky tool, I can say the following. There was a set of very rapid opening up sequence of the economy on late April, in April, and then late April, and then in May. And these were not followed up by an increase of cases. So despite the fact that the economy in Israel was opened up almost as quickly as it was shut down, and we were exceedingly effective in shutting everything down in order to stop the virus spread, achieve a complete containment on the first wave, and this was really hailed by many other countries as a very successful effort, closing up borders in time. But then when it came to opening up, we did open up as quickly as we closed. And at the very early on, it went well. And there wasn't a surge of cases, and it proved that while the population was still under the influence of the previous events and the opening up wasn't too bad. But then two things happened. One is that some of the opening of the restrictions has caused a slight but continuous increase in the number of new cases, which was an indication, according to plans, to say, wait a minute, this is not working as planned. Maybe we should at least stop further easements and do some watchful waiting and see if we need to draw back. But instead, after 2 weeks approximately of such a gradual increase, the next set of opening up happened as planned. And congregations of 250 and more were allowed, despite the fact that the disease was in an inclination pattern. So I think that is something that we should learn for the future, which is probably not a good idea. If you are not in a stable condition, if your indicators show an incline in the number of new cases, that is not the best time to allow mass gatherings in an illness that is now known to pass most efficiently through mass congregations and in a small number of super spreader events. So unfortunately, that has proved to be one step too far, and Israel has experienced, I think, a surge that is pretty severe. Overall, the increase from about 100 cases per day to about 1,000 cases per day in about a month, and that is made out of two vectors. One is a 2 to 2.5-fold increase in the number of tests being done. So this is responsible for about half of that increase, but there's a 5-fold increase in the percent positives among those tested. So what we can see from this is not a factitious increase due to increased testing. This is an actual increase in disease spread all over the country that is witnessed in the testing being done.
Aren't we crying wolf here? Because the assumption was that the key figure to monitor is the number of people who need ventilation. And I think it's less than 30 today when we have, I believe, 3,000 ventilators. So isn't there too much panic here?
I think nobody's panicking. I mean, if at all, there's a stoic, resistance to further steps. So that I don't see panic on one hand. The second thing that you need to remember that while the most stable and best indicator is the number of severe cases, you have a problem with this indicator because, first of all, it lags about 3 weeks after the actual events have occurred. So by the time you understand that you have a serious problem of surge capacity in your severely ill cases, most of the damage is already being done and you'll see it in 3 weeks later. So this lag of time does not allow you as a decision maker to make your decisions according to the number of severe cases you see in your own eyes in the intensive care beds. So this is point number one. Point number two, when you talk about respirated, we have learned from the previous wave that we should do the best we can in order to reduce the number of respirators used. So we try to maintain our patients off the ventilator as much as we can. We treat them very early to prevent deterioration, but we try to keep them off the ventilator as much as we can. So ventilators are even lagging on after and beyond the severely ill cases. And finally, about crying wolf, we have moved in June, we had about 100 severe cases hospitalized. In the last 5 days, we had 95. So this is very unfortunate because up until then, we had up to 7, 8 severe cases per day. And suddenly yesterday, we had 25. So if there's anybody who thinks there's a way to uncouple the association between cases and severe cases, reality proves again and again that this coupling is very true. Virus is no tamed cat at this point. It's only waiting to manifest its true potential of causing serious health harm on a population level.
Two questions from our journalists who are watching you right now. One is the lockdown. How does it affect families, especially in the ultra-Orthodox community with big families, when you lock down a family and then they each infects the other? The second question is about opening the schools. Is there a safe way to open schools, or has the opening of schools added to the outburst of the second wave?
I think regarding schools, start with schools. Schools, the jury is still out. There seems to be an effective way of maintaining schools open and sustaining the disease dissemination. I think that the way we've started with school opening with what we call the capsules and the very distancing approach to schooling with part-time home tele-education and part-time in the classes, and depending on the different age groups, those who can stay at home and alone and those who cannot, and therefore will disturb the economy, was an excellent, last stand that we can take. And I think this is a safe and effective way to continue schooling, even almost at the hardest times. So when we'll get to September and October, I think that approach would be maintained, and it is possible, and it is actually crucial to keep schools open and to allow education that way, especially for the younger kids. We still need to improve our ability to do teleeducation in an effective way and to have a mixture of in-person teaching and distance teaching. But again, we have a few months to improve our capabilities and capacity there in order to be ready for September, for the New Year's educational year. And I would also mention that in everything that I've seen, the relative proportion of kids being infected in those recent waves has not really surpassed dramatically at all their relative number in the entire population. So I don't think that kids necessarily were the elicitors of the second wave. I would actually look more at the opening of wedding halls and large gatherings, and this was truly our point of weakness. To say a word about lockdown, lockdown is a bad thing. It is the worst measure that you can take. It is the last, it's your last stand when you think about what you can do. It's no magic bullet. As you've said, when you lock down large families in small places and you don't open opportunities for people to be isolated away from the condensed crowds, it is not as effective as it could be. But again, sometimes you have to take the last stand measures when there's no other option in order to stop dissemination, and when population is not able through its own internal mechanism to sustain and to prevent further disease dissemination. So when everything else fails, all you're left with is partial location-specific lockdown.
There's a question about testing. Would a larger operation of testing will also bring about a significant increase in the number of people found affected?
Of course it does. You double the number of testing, you almost, not completely, but you increase the number of people infected you will find. We know that we have not and will not be able to detect through daily testing each and every infected case when the numbers are so high. So we know we're missing many, and if we test more, we find more. The question right now is, what is the aim of testing? And the aim of testing, because first of all, what people need to do is when they know that they've been exposed to an infected patient, they should go into isolation regardless of the question whether or not they have been tested and been shown to be positive, because the positivity lags in time after being infective, and because there's some people say 30% false negatives at a different point of time. So it's not about how you should react. The importance of the testing is first and foremost to increase your ability to contact, to identify the contacts, warn the contacts, and increase the circles of contact tracing and isolation. So at this point in time, it is very difficult to achieve that in such a large number of infected patients per day. And so the tool of testing is becoming less crucial. With that, I will say that Israel is testing among the highest rates per capita in the world right now. The number of tests being done in this country exceeds those of almost any other country out there. And I think that is a very good thing. It gives you a very good, picture of where you are. And to some extent, the numbers in Israel are not as high as compared to other countries because we test more than almost any other country. And we also need to always remember that.
One of the main criticism leveled at the conduct of the government is that the Ministry of Health is good at regulating, not at management. and that any attempt to create a serious, effective structure of management or to hand it over to bodies which has been developed specifically for this case, like the National Emergency Authority or Ministry of Defense, were torpedoed because of political motives. What is your take on this?
I've heard the Director General of the Ministry of Health in several interviews in the last few days repeatedly said that the Ministry of Health feels very positively about having qualified operators of any other sector to come and take part and help in taking the immense logistic requirements of running such a crisis. And I think right now, as we did early on in this epidemic, there's a joint forces of various sectors in this country that are capable of taking logistic effort, and that includes the various sectors. Everybody chips in, local authorities, the Ministry of Health, the military and security forces. Everybody with their own talents tries to support this joint national effort as much as they can. I hope this conjoint effort would actually ensue right now with more collaborations and allow us to deal with the crisis even better.
Before wrapping up, on July 23rd, 2 weeks from now, Clalit, together with HIMSS, a leading global society supporting health systems through information and technology, is holding a conference which will be broadcasted worldwide, titled FutureMed 2020, Unfolding Pandemic. Can you share with us some of the highlights of the conference?
So yes, this is an event done with a combination organized by Clalit and by HIMSS. HIMSS is the largest organization worldwide dealing with health technology and ITs. And those two organizations have moved together to bring the best and brightest minds out there globally. And to do some joint thinking and lessons learned and retrospect, and inspection on what can we learn from the massive experience by now of different countries, different organizations, in order to better tackle COVID-19. In this event on the 23rd of July, we will see people like the Director General of the NHS-X, which is the technology arm of the NHS, the head of WHO Europe, the regional director of the World Health Organization for Europe, the director of global health for Harvard Medical School, the director general of AI, the editor of the New England Journal of Medicine, the editor of Nature Medicine, and the chairman of one of the world's largest pharma company. And I can go on with a grand list of the brightest minds out there. And they have all been sharing with us some of their insights on what we can do better in tackling this current ensuing waves, but also in preparing for winter. Because as we know, the combination of influenza and COVID-19 could be quite detrimental to global health, both by increasing the rate of infection by people co-infected with flu and COVID-19 at a time, but also by having us sustain a COVID-19 increase in a time where flu fills the ICU beds with its own complications. So this is a pretty grim scenario, and we must all as a global community unite. And so this event, FutureMed 2020, that will take place on July 23rd, would give us some insights on how this can be done. It will be broadcasted here in Israel by N12 and definitely by HIMSS and HIMSS TV and various, and there will be multiple news networks that will cover this either live or in retrospect. And so we welcome each and every one of you, if you are interested in this, to contact us, and we will send you relevant information about this and allow you to join in real time to this event.
And we will be happy to assist you with contacts. Professor Balicer, thank you for being with us, for your excellent presentation and Q&A session. I'd like to thank my colleagues at JPC, Talia Dekel, Rachel Exil, for facilitating this briefing. Stay tuned to our next webinars next week, starting on Sunday at 11 with Dr. Michael Halbertal, General Director of Rambam Hospital, and on Tuesday at 11 with Professor Eli Waxman of Weizmann Institute. Have a safe weekend. Thank you all.